Hi, health class. We're going to start our unit on sexual education with a presentation called You and Your Sexuality, especially for teens. This is from a fact sheet that I found from the American College of Obstetricians and Gynecologists, Women's Healthcare Physicians. Our lesson overview, reviewing the frequently asked questions as it relates to teens and sexuality. I'm kind of going to read the questions that were frequently asked and give the answers. Identify and discuss the range of sexual identities and the range of sexual expression. Within those identities, these are objectives. Examine the range of sexual intercourse behaviors. Analyze factors including alcohol and other substances that can affect the ability to give or perceive the provision of consent or sexual activity. It's not really a deep dive, but we do touch on these. What happens during puberty? You ever think about that? What's going on? What's happening with my body, my voice? When puberty starts, your brain sends signals to certain parts of the body to start growing and changing. These signals are called hormones. Hormones make your body change and start looking more like an adult. Hormones also can cause emotional changes, those mood swings those teenagers seem to get. What emotional changes occur during puberty? During your teen years, hormones can cause you to have strong feelings, including sexual feelings. You may have these feelings for someone of the other sex or the same sex. Thinking about sex or just wanting to hear or read about sex is normal. If you happen to watch Pornhub or anything like that, these are actually normal teenage behaviors. It is normal to want to be held and touched by others. How are sexual feelings expressed? There are many ways to express sexuality. Sexual intercourse is one way. Others include masturbation, oral sex, and anal sex. And here I give you a diagram of genitalia, female genitalia variations and male genital variations. And you can see pubic hair, clitoris, urethra, vagina, labia. It gives you different size labias because no matter the size or shape of your labia, they are all normal. It gives you normal hymen variation. Some of us have hymen, some of us don't. If you're looking for something to tear or to break when you lose your virginity, that's not always necessarily the case. Your hymen can stretch out during gymnastics or riding a horse or a bike or things like that. And male genital variations, of course, you have your pubic hair, your penis, your foreskin, if you are uncircumcised, your urethra, and your scrotum. The shaft and the glands of your penis glands is another word for your head. Whether circumcised or uncircumcised, again, you still have a normal variation of penises. What is masturbation? Touching or rubbing your own genitals, clitoris and vagina in girls and penis in boys can give you pleasure. This is known as masturbation. Touching a partner's genitals or other parts of his or her body can provide sexual pleasure. Touching will not cause pregnancy and is less likely to cause a sexually transmitted infection and STI than other forms of sex. And what it means by less likely is that if you are touching an infected partner, remember that some STIs can be spread through fluids. And so let's say you have any type of fluids or open sores that you're touching and maybe you touch yourself or vice versa, there is a risk that you can spread STIs. So you're less likely, but there are chances, so be careful. These things can occur. What is oral sex? Oral sex is when one partner's mouth comes into contact with the other partner's genitals. Some teens believe oral sex is not really sex because it does not cause pregnancy, but it can spread STIs. Using a condom or dental dam during oral sex can help protect you against STIs. What happens during sexual intercourse? During sexual intercourse or vaginal sex, the boy's hard erect penis goes into the girl's vagina and moves in and out. This can lead to orgasm. During vaginal sex, when the boy has an orgasm, he spurts semen, which contains millions of sperm, from his penis into the girl's vagina. The sperm can swim up into the uterus and then a fallopian tube, where one can fertilize an egg. This can lead to pregnancy. Sexual intercourse can also spread STIs. And here I give you a diagram, of course, of insemination, which occurs and how the path of the sperm goes up through the uterus and through the fallopian tube where it meets an egg. Sperm swarm around the egg. The head of a sperm enters the egg. Only one sperm will win. A new membrane forms to prevent further entry of sperm, and then there's fertilization. What I do want to also tell you is that an egg lasts for 24 hours. Now, you do get a little window of fertilization for those of you who have a period tracker. And within that window, it's usually about 7 days because no one knows exactly when your egg will be released. So it gives you those days, and it gives you that many days because sperm can last up to 5 days. So let's say you're not going to ovulate until Friday. but you had sex on Sunday or Monday, those sperm can survive to meet that egg on Friday. So that's why it gives you that window of fertilization. What can I do if I want to have sexual intercourse, but I do not want to get pregnant? If you have vaginal sex and do not want to get pregnant, use a reliable birth control method every time. Birth control can reduce the chance of pregnancy occurring. How can I protect myself and my partner from sexual transmitted infections during sexual intercourse? Using an external and internal condom the right way can prevent pregnancy and protect against STIs. Even if you are taking birth control pills or using any other form of birth control, you still need to use a condom to protect against STIs. And then in our next module, I'll have a playlist on YouTube of different forms of contraception that help prevent pregnancy and STIs, and then also how to talk to your partner in the event that you were to get one. What is anal sex? Another form of sex is anal sex, in which the penis is placed into the other partner's anus. This form of sex can greatly increase the risk of getting an STI, including human immunodeficiency virus, HIV. Anal sex can cause tiny tears in the rectum and anus. The germs that cause an STI may enter the body through these tears. Using a condom during anal sex can help protect you against STIs. What does it mean to be gay, lesbian, or bisexual? Being gay is when a boy is emotionally and sexually attracted to other boys. Being a lesbian is when a girl is emotionally and sexually attracted to other girls. Bisexuality is being attracted to both sexes. Many boys and girls are attracted to members of their own sex during puberty. Things they have done, holding hands with a friend of the same sex, looking or touching each other's genitals, may make them wonder if they are gay or lesbian. These activities are normal in teens. Some discover that they are gay, lesbian, or bisexual during these years. There are other gender and sexual variations that may be expressed as well. Can I choose to be attracted to someone of the same sex? Being attracted to people of the same sex is not a choice a person makes or something that can be changed. Some people may have a hard time talking about being gay or lesbian. Some may not be accepted by their families and friends. This may lead to feeling lonely or depressed. Some people may even consider suicide. If you think you may be gay, lesbian, or bisexual and feel confused or unhappy, talk to an adult you can trust. If you cannot talk to your parents, ask a teacher, doctor, or school counselor to help. What is gender identity? Gender identity is your sense of being a boy, a girl, or other gender. Some teens feel that their gender identity, how they really feel about themselves, is different from their physical bodies. A girl may feel that she is really a boy and vice versa. Others may feel that they belong to neither gender or to both genders. People who feel that their gender identity is different from the sex they are born as are described as transgender. It often is difficult for parents or schoolmates to accept that a person is transgender. Transgender teens may face bullying or discrimination. Some may feel scared and alone. If you're feeling confused about your gender and it's causing you distress, or if you're being bullied or mistreated, talk to a trusted adult. When deciding whether to have sex, what are some things to consider? Ask yourself what your feelings are about sex. Are you really ready for sex? If you're dating, do you know how the other person feels about sex? Have you had those conversations? Make up your own mind about the right time for you. Do not have sex just because you think everyone else is. Oftentimes they're not. People sometimes say they are, or they talk about it because it seems cool, but you just never know. You think it will make you popular. This is not the way to get popping. Be yourself. You are talked into it. No. You're afraid the other person will break up with you if you do not. You feel that it will make you a real man or a real woman. What if I decide to wait and someone tries to pressure me into sex? If you decide to wait, think about what you will say ahead of time if someone pressures you to have sex. The following examples can work for girls or boys. If you love me, you will have sex with me. If you really love me, you will not pressure me is the answer. No. You're the only one I will ever love. Good, then we have lots of time later. If it's just me and you, we got plenty of time. We don't gotta rush this. If you don't want to have sex with me, I will find someone else who will. Oh, that's your choice. My choice is to not have sex. You can do what you want, but I've made my decision and you should respect my boundaries. Thank you. What is rape? Rape is any genital, oral, anal penetration without consent. Most victims know the person who raped them. It may be someone a person is dating. It may be a friend or their own age or an adult. The offender might use physical force or threats. Often alcohol or drugs are used before rape. No matter who the offender is, rape is a crime. What are some things I can do to help protect myself against rape? Although rape is never the victim's fault, it makes sense to take precautions to protect yourself. Avoid situations that might put you at risk of unwanted sex. Avoid walking alone. Limit alcohol and drug use. Never leave a drink unattended. And we talked about that during our drug and alcohol unit. If you go to a party and you put a drink down, you go to the bathroom or anywhere else, when you come back to it, pour that out. Always go to parties with a friend and check in on each other. Make sure your friend is good. Make sure no one's taking advantage of them, and vice versa. Never leave without your friend and never leave with a stranger. Leave with who you came with. What is intimate partner violence? This type of violence occurs between couples in same-sex or opposite-sex relationships. It can involve physical violence, sexual abuse, or emotional abuse. Even threats of violence are considered intimate partner violence. If you're in an abusive relationship, it is important to seek help. Tell an adult, parent, teacher, doctor, or counselor. And I believe this is our last slide. I'm going to put a couple links down there for you for RAINN, as well as the consent video, where consent is like tea. You'll find with this module, there will be an exit ticket with one question. There'll be a short 3-question quiz. And then there will be like a little worksheet that goes with this. And so 2 of those will be regular credit. 1 of those will be extra credit, and the same will be for next week. Just because I think I'm behind for 1 of each in each assignment category, and this will help us catch up, but they won't be anything too hard. If you have any questions, please contact me, send an email. Usually when we're in class, I'm able to answer your questions in real time. When we meet this week, I'll make sure I try to answer questions as well. I'm here to help.